Welcome, everyone. Thank you for joining us for today's webinar. Today's topic is Paying Participants in Research, Regulations, Ethics, and Practical Considerations, and it is presented by Dr. Brandon Brown from University of California, Riverside. Dr. Brown is a professor of medicine in the Department of Social Medicine, Population, and Public Health at the University of California, Riverside. His primary research interest is on ethical issues in HIV research, and he works closely with community partners in every step of the process. The first in his family to attend college, Dr. Brown earned a PhD in international health at the Johns Hopkins Bloomberg School of Public Health. He received additional training as an HIV Prevention Trials Network Scholar at the Fordham HIV Research Ethics Training Institute and at the Hastings Center for Bioethics.
So we have 4 learning objectives for today. They are to identify the regulations for participant payment and research, describe limitations in payment data, discuss some of the factors that determine payment, and then highlight a study that illustrates one possible solution. I'd like for you to imagine that you're a potential study participant, a person living with HIV visiting the clinic as part of your routine healthcare. You read a study flyer here about an early phase HIV cure-related research study and make a conscious decision if you're interested to learn more and qualify. Most people might see this and say, what's in it for me? One altruistic idea is the prospect of contributing data towards developing an HIV cure. And some folks might think, hey, I could be cured as part of the study. But it's good for all parties to understand that this is research and not something that's expected to give direct clinical benefit, particularly at this point in time for HIV cure. Now, if we offered you payments in the amounts here, might that influence your interest? What about $5, $100, or what about $10,000? What about if the number of visits was varied? That might make a difference as well. So this is just to get you thinking a bit on what influence payment might have and how it's weighted with other study factors. Something else that might matter to you is how is this payment going to be provided to me? Cash, gift cards, PayPal, a check, or what? And in terms of payment decision-making and research in general, knowing what has been provided in similar previous studies might help us make a decision on payment amounts, because at least we would have some data points as a reference. And every payment amount may be specific to the research topic and the amount of funding available, or maybe by participant factors like local cost of services, salaries, or healthcare access. But if we're new to research, it might be hard to get a sense of what is fair. And if we change our role from a study participant to an IRB analyst or PI of a study or study sponsor, we might ask if our perspective on payment changes. It likely would.
In closing, I also invite everyone to review our content offerings regularly, as we are continually adding new courses and webinars in various areas of research, ethics, compliance, and professional development.